My name is Dr. Joe Goldberg. I'm a clinical professor of psychiatry at the Icahn School of Medicine in Mount Sinai in New York. I'm here today to talk with you briefly about the phenomenon of PTSD, or post-traumatic stress disorder, in particular, demystifying PTSD. So what is PTSD? Post-traumatic stress disorder is essentially an abnormal response in the brain to a traumatic event. It's not a normal, explainable, oh yeah, this would happen to anybody kind of thing. Trauma can happen to anyone. About 50% of people endure some kind of trauma. But in the case of PTSD, we think about severe trauma that's fundamentally threatening to someone's sense of well-being, safety, their life, their ability to function. It's an enormous sense of threat that can leave one feeling helpless, horrified, unable to do anything to take care of themselves, to escape from the threat. So it could be life-threatening. It could be trauma in the form of abuse. That could be physical assault, verbal abuse, sexual abuse. It could be a one-off event like a natural disaster or combat in the case of military PTSD. It could also be chronic exposure to trauma, again, in the case of combat-related trauma or PTSD, or in the case of abuse, protracted physical abuse, emotional abuse, sexual abuse. So again, the key criterion is the nature of the trauma has to have some fundamental sense to one's overall sense of safety and well-being. Now, if someone endures that type of traumatic experience, it could lead to an abnormal set of behaviors and thoughts and feelings that emerge that persist for some number of weeks, in fact, at least a month or longer, that starts to involve, well, kind of a hyperarousal, hypervigilant state, a deep level of fearful concern about one's safety and the environment, a sense of avoidance, so staying away from any reminders of the event that occurred. I'm not walking down that street again. I'm not talking to this person. I don't want to be associated with the environment that evoked the trauma or the fear response. Could mean a sense of re-experiencing and reliving. So ruminatively going over and over the event in your mind, rehearsing it in a way, and then leading to mood symptoms or cognitive symptoms like sadness, despair, crying spells, irritability, panic, anxiety, a whole range of problems that might then coalesce. It can include nightmares, flashbacks. So it's really an overlearned response. Think of the part of your brain that's responsible for learning and memory. You might remember certain events more vividly if they're attached to a very positive emotional experience, a charismatic teacher, a really engaging speaker, and it evokes rather readily a positive experience. Now imagine if instead of a positive emotional attachment, there was a negative or aversive one in which your sense of safety became jeopardized. You felt that you might be harmed. That can lead to the things I just described in terms of hyperarousal, fear, vigilance for one's basic sense of safety. And that's essentially what PTSD is. It's an overlearned response with fear and apprehension to some traumatic exposure that occurs. About 3 to 4% of the population develops PTSD. It's a little more likely to occur in women than men. It's a little more likely to occur in people that have had some pre-existing exposure to a traumatic experience. So this gets into the sort of debunking question of, well, who experiences trauma but doesn't get PTSD? What's protective against PTSD? What might confer resilience? Because again, having endured a trauma, as I said before, is not synonymous with PTSD. Someone who's experienced early life adversity, childhood abuse, or been a victim of an assault early on may have been, well, primed in a way for a second traumatic event that might come along later in life that could activate those initial features that might then lead to this overdrive state of fear, hyperarousal, the emotional dysregulation, all the associated features. For many people, the symptoms of PTSD can go on for more than a month, several months. And about half of people may go on for as much as 6 months, and in some proportion, even longer than that in an ongoing fashion, which is one reason why it's very important to make a proper diagnosis, to screen for PTSD in people that have experienced severe traumatic events, and to recognize the symptoms when they're there. Hyperarousal, hypervigilance, re-experiencing, reliving, avoidance, and the mood and cognitive symptoms. And then offer the appropriate kinds of treatments. Treatments include both psychotherapy-based treatments and pharmacologically-based treatments, and it's a very expanding area of research at the moment. So early detection, proper treatment are essential to make the right diagnosis and provide the best possible outcome.